Hello and welcome to the sixth CTIS walk-in clinic. My name is Roxana Spulver and I'm a Change Management Officer at EMA. First, let me start with some housekeeping rules. We will be using Slido to collect questions. Here is how to use Slido. Go to slide.do and enter the code on the screen. Clinic 6 or scan the QR code on the screen. The passcode and the QR code will be visible on all the presented slides for ease of access. You can ask your questions there and give a thumbs up to any question you want to see answered. We will answer the most popular questions first, so please ensure to use the thumbs up feature. Please keep the questions focused on CTIS functionalities. If the video screen is blurry or difficult to see, please read the instructions in the gray box underneath the video on the event page. There you can find a link to watch the live broadcast on full screen. In full screen mode, you can increase the video quality by clicking the HD button on the bottom right of the screen and choosing 720p or 1080p setting. I will now introduce some pieces of useful information related to CTIS before introducing the CTIS experts that will be present today. CTIS allows sponsors to upload for publication and not for publication versions of certain documents, including the protocol and the investigator brochure. This functionality allows sponsors to protect personal data and commercially confidential information. In CTIS, by only providing such information and in the not for publication versions of the document. To assist sponsors and authority users in fulfilling the transparency requirements set out in the clinical trial regulation, EMA is preparing a dedicated guidance on the protection of personal data and CCI in CTIS. EMA has published a draft of the guidance for open consultation to allow for wider stakeholder input and to account for experience gained in working with CTIS. The draft guidance and the details on how to provide feedback can be found on the CTIS training and support page. The deadline to comment is 8 September 2022. A stakeholder workshop will be held during the public consultation period. Further details will be shared in the Clinical Trial Highlights newsletter when it is available. For more information on CTIS, you can consult various resources. Some of them are listed on this slide. The CT Highlights newsletter, the training and support page, and for guidance on CTR interpretation, you can consult UDRALEX Volume 10. I would like to introduce our experts now. With us, we have Noémie Manon, Principal Scientific Administrator and Leader of the Operation Workstream for the Clinical Trial Information System, enabling the application of the Clinical Trial Regulation, and Ana Rodriguez Sanchez-Beato, our CTIS Deputy Program Manager, that has been involved in the implementation of the Clinical Trial Regulation and development of CTIS. I am now handing it over to our experts.
Hello, good afternoon to everyone. I hope you can hear me well. We will try during this session to address the CTIS related question. For sure, you may have other questions that are more regulatory questions, and we will try to answer those as well if we know all the details. Otherwise, we can refer you to the right documents where you can find the answer to those questions. And I hand over to my colleague, Noémie.
Good afternoon, everyone. So very welcome to this walk-in clinic, and we look forward to have your questions. So do fill in your question on the Slido, and as colleagues have said, do indicate a plus. This way we'll take obviously the questions for which that have been voted the most and are the most popular.
And now I'm sharing Slido, and we already have 10 top questions. I I will read the first one while I'll tackle the technical side, okay? So the first one is, in case we need to add in CTIS an authorized product considered auxiliary and the sponsor is not providing it, the hospital pharmacy will choose the exact product. Is sufficient to submit one generic SMPC as an example?
So I guess I'll take this first question. So in case the sponsor wants to associate to their clinical trial an auxiliary product, there is such functionality in the system under the product subsection. The sponsor in this case can certainly define the product either as through the substance, because here we have an authorized product, so defined through the substance or the ATC code. And in such a case, obviously, it makes sense to supply a generic SMPC.
Great, thank you. The second one is it required to add the last 2 digits of the EU trial number to the protocol?
I think this one jumped a bit too quickly.
Yeah.
I think,
If there is a
Roxana, yes, thank you.
resubmission, for example, these will update during the trial. So we would need to update the protocol every time we included them. So I'll repeat, is it required to add the last 2 digits of the EU trial number to the protocol? If there is a resubmission, for example, these will update during the trial. And so we would need to update the protocol every time if we included them. Thank you.
Yeah, we know that that could be a problem from the sponsors if they try to resubmit, because that will requires to change this number in all the documentation, and obviously this may cause delays on top of it's not very efficient for you. It's true that this particular point has not been addressed by any Q&A at this moment. So what I can say is probably my advice is that you can always indicate in the system, it will be clear that it's a resubmission because it has this 2-digit extension. So I presume if in the documentation is still not clear, may still be possible to submit it without these 2 digits whenever you make that clear in the cover letter that you are going to submit with the resubmitted application. Nevertheless, my advice is also that you confirm that with the member state where you try to submit your trial, you have a list of contact points with email addresses in the UDRALES Volume 10 when you can ask this particular question to prevent problems. Perhaps this is something that we may need, perhaps, Noemi, perhaps we can reconsider to have this discussed in one of the forums or expert group or CETA group to see if this may need to be clarified via Q&A and if there are concerns by member state with regard to this particular point, because we understand that it can be problematic for sponsors. I don't know, Noemi, you want to complement or say something on top?
Yeah, no, thank you, Anna. I think very much as you said, I would certainly support that there's a clarification on that. We understand that the resubmission, the way it's been implemented, obviously appears in the actual trial number, but really what the focus was to keep exactly the same trial number and with this 2-digit at the end. So I think I support the need to have this probably tabulated at one of the MS trainers forum and probably with the commission as well. Yeah, no, that's a good suggestion. We'll take note on that. Yeah. So I think the next question is on the timeline for the removal of the OMS registration step to add sites. So here we say to add investigator sites, particularly in CTIS. So I think, Anna, do you think, an actual timeline for that implementation? Do you think?
I think it's planned in July. So, however, I mean, this type of problems sometimes maybe advance or delay if there are other priorities on top, because we are receiving incidents over time, and therefore other things may come on top, and this may be delayed. But the current plan is in July. But again, we will ensure that it is properly communicated once this is done.
Okay, no, thank you very much. The next question is on the IMPD being cross-referred between trials. So I think this is a question we have received also through our service desk. We have received it also by email, and there's obviously a great interest on how to resolve this, this particular topic. So here we're talking about an investigator-sponsored trial that is collaborated potentially with another organization, and that other organization is certainly provided the IMPD. So how would the investigator sponsor notify the fact that the IMPD is being provided by another organization? So can the sponsor refer to another trial? Yes. So if this other trial is currently in CTIS and is submitted to the same member state concerned, this cross-referencing is very useful, because this way it is not required then to provide the IMPD, because you could refer directly to it, and then the MSCs would have access to it and potentially would have already assessed it. Now, how does that work if the cross-reference is made to a UJCT trial? I think the same logic could apply, but then obviously we need to make sure that the MSCs that are receiving this new trial have had access to the IMPD and indeed have assessed the documentation. So what needs to be, we need to really take care of here is that the MSCs have access to the documentation and indeed have assessed it. And in case this IMPD needs to be updated, obviously they need to have the trial ongoing in order to be able to assess any update that would be made through an amendment, substantial amendment. I think this is the way to respond to this in terms of cross-referencing. So, and then the last part of the question is, some sponsors are not providing IMPD to the investigators who are conducting IST with their IMPs. So correct, we are aware of that, and this is why we have this mechanism of cross-referencing. So now, what would be the third scenario when obviously there's no trial with this product and this IMPD? So in such a case, I must say there is a way in the CTIS system for the sponsor to provide the IMPD through the specific role. But obviously, with such a methodology, the sponsor would still have access to the information because they are submitting the full package. So there is a way, obviously, the confidentiality of the information is not 100% there. So another possibility then for you is to contact the member state. I think some of the member states have indicated that this is also a possibility. So please have a check, certainly with the sponsor would provide the IMPD, whether they've already submitted a trial and to the same member states, in order for this investigator-sponsored trial to be able to cross-refer to any other trials.
I will take the question about the one on the videos. In the last session, you confirmed that the videos, sorry, I could not move. Could not be uploaded to CTIS. Can you please confirm if QR codes that lead to videos allows? I want just to remind you that in the sponsor handbook, you have a section where it guides you to the structured data and documents that are required for each of the application type, initial, substantial, modification. And in that document, you can see for each document upload area which type of documents are allowed. So if it's PDF, if it's a Word document, if it is an image, and so on. So my advice is that you have a look to that document, because obviously it will depend on the placeholder, and I presume the scan, the QR code can be added as a photo or something like that. So it might be possible, but again, it depends on the upload area where you want to include this document. That's why my recommendation is that you look at this document where you have access from the if you want to find it quickly, from the sponsor handbook that is made publicly available in our website.
So the next question is, what are the responsibilities of the contact point for the union? So this is a particular field that exists in the CTIS sponsor subsection. This contact point is for the sponsor to indicate what are the contact details of this particular point of contact for the member states. This information is not published on the public website. This is very much for the member states to be able to contact one individual with hopefully telephone number, email address, in order to be able to get hold of somebody at the sponsor location. So this is an information that is required by the clinical trial regulation. And obviously, the information is provided here in structured data within the CTIS, as I said, sponsor subsection.
Okay, I will take the next one. Is there any progress on the issue with the delation, cancellation of trials, and when the issues around this will be fixed? This is in the last version of known issues, issue 32. Currently, if select to cancel a trial and press X instead of cancel or confirm, the trial is deleted. Yes, you are right. We are aware, very well aware of this incident, and we are trying. So we have created a problem that consider all the incidents that have been reported around this, and we are going to give it a high priority to be implemented. But again, as I said previously, there is a list, and there are some things that has higher priority because that's prevent the user or block the user to continue. So we cannot give you a concrete answer now. It's in our radar and in our plan, but not specifically. I can let you know because also I don't know by heart when this can be done. But it's in our radar, and we know it's important for you.
So the next question is on transitional trial. And the requester saying that it seems that some countries are asking for a complete part 2, not only the informed consent form. Do you confirm that we have all legal basis to push back countries in order not to ask for a complete part 2? Is it planned something from EMA as well to avoid such country requests? Okay, so what needs to be understood is that the Q&A from the Commission is quite clear. The information that the sponsor needs to provide in the part 2 of the dossier for a transitional trial is any document that have been authorized under the clinical trial directive. So I believe it's not just the informed consent. You would have other documents as well. However, it is correct that under the clinical trial regulation, there is one specific document that is called the Suitability of Sites. This information do not need to be provided and cannot be provided because obviously under the CTD, it was not submitted, therefore it was not authorized. So the guidance here for you is to provide all the documents that were authorized by that member state at the time when the trial was authorized under the CTD. So I think the next question seems to be quite similar, no? In a transitional CTA sponsor is required to include only the ISF in part 2.
Here I can clarify that.
Please, Anna, please, yeah.
But I think this is very clear in the Q&A from the Commission, but I think my understanding is that it's the second case. So you will not submit when you transition the trial with let's say the initial application. You are not obliged to provide these documents. But then at the time of the substantial modification, you are expected to include those documents. So if those documents have changed, then you will include the document that has changed, because it's supposed that they already had the old version. If the document have not changed, then you will have to take the opportunity to include those documents in this as part of the substantial modification. So I think, let's say both I think both will apply, but probably we will need to check if this is clear in the Q&A from the Commission, and perhaps, Rosanna, we can take note of this, because if not, perhaps we can make this more clear. I mean, we can ask the Commission to make this more clear. Because for me, my understanding is that you need to put everything. So at the time of the substantial modification, you need to put those documents that were not applicable when you did the transition. But now, with the substantial modification, is the opportunity when you are requested to do it. But perhaps we need to check the Q&A, and if it's not so clear, then we may need to make that more clear with
Thank
the
you,
Commission
Anna.
group.
Thank you. I have marked it down. Thank you.
So the next question is on is in relation to the, I guess it's the training material, module 17. Yes, so we have some material that shows how the notification can be done. And here the question is, so if there's an RFI that is issued to the sponsor and then the sponsor provides a response, will the information be made public? Does the deferral have any impact, and when above mentioned information will be made public? So clearly, if there is a notification, the information is made public at some point, correct? It depends what sort of notification. So here we're talking safety, so it's probably an urgent safety measure, or it's a serious breach, or it would be, what is the third one? Unexpected event notification. So those three notifications needs to be assessed by the member state before they are published. So this is why during the assessment, the member state may raise a request for information. The request for information and the response to the request for information would not be made public. What is only pushed into the public website portal is the actual notification itself, the content of it, the way the sponsor has actually notified it to the sponsor. That is what is made public. Now, if there is a deferral, yes, it is possible to defer the publication of notification. For sure, in the category 1, it is possible. I don't believe it's the case for category 2 and 3, but we will need to check. But then it's easy for you to check if the line allows for deferral of notification to be ticked, then you can. And in such a case, it means that once, even after the member state has assessed it, the publication will be done according to the timing of the deferral, obviously. Yeah.
Okay, then I will take the next one. In a given member state, it is possible to submit Part 2 as soon as it is ready, regardless of the status of Part 1 assessment. And I think this is very clear in the regulation, as well as you have a specific Q&A about this. And you can only submit the Part 2 following the notification of the conclusion on Part 1, but only during the subsequent 2 years is when you can submit an application. So you have to wait for the conclusion on Part 1 to be issued, and then within the 2 years, subsequent 2 years, then you can submit the Part 2. Again, you can find the answer. This is very clear in the legal text and also in the Q&A from the Commission.
So the next question, I will ask you to address it directly with the member states in which you're currently running your trials, because this is very specific on how to harmonize your protocol, and they will give you they will provide you with the guidance, and especially that you may have applied for a VHP, I don't really know, but then you will need to then have an RMS at some point. So please do consult directly with the member states of the countries where you're running your trial.
I'm going to take the one on the legal representative. I will leave the other one on auxiliary products to you, Noemi, as you're more familiarized with that functionality. Are the contact point for the union responsibility the same as for legal representative? Well, I think as Noemi has already explained what is the role of the contact point for the union, the legal representative is only required when the sponsor is not based in Europe, but in another country, in which case you are required to have a legal representative. And again, more information around this is indicated in the Q&A from the Commission, where you can find more clarification.
So the next question is on how to select a product. Obviously, this is for an auxiliary product. So this is a marketed product. In such a case, the sponsor could select the product via the recording of the substance name. So there is a special functionality in the system for this. And the sponsor is asking how to choose one if some options are the same regarding dose and formulation. So I must say, I think we have some, it depends on the UI and what you have seen. But if you have such issue, I can only suggest you that you submit a ticket to the service desk, because in fact we should not have duplicate row within the UI. And from what you're saying, it seems like it's exactly the same information. So if you encounter such issue, please submit a ticket to the service desk, because in fact you should be provided with sufficient information in order to select the information. So here, obviously, it doesn't seem to be the case.
Okay, I'm going to take the question on the last one, because it's the one that now have moved down, but I was looking at that before. So will urgent safety measures, unexpected event, and any advice concerning those safety notification be publicly available? As it's clearly in the legislation that all notification will be made publicly available in the document about the disclosure rules that have been implemented in the system. Obviously, some notification, it will be published immediately. Others will require assessment by the member states, and among those include this, the one that you have highlighted here. And therefore, after when the member states look at those, they may require an ad hoc assessment or might not be needed, but then they are responsible to push forward the publication of the notification. So at a certain point in time, for sure, this should be made publicly available.
Okay, and then, so the next question, when transitioning a trial, is a cross-reference letter for the IMPD still sufficient when the cross-reference letter was also part of the original submission? If a cross-reference letter for the IMPD is still sufficient. Oh, okay, yes. So I guess in such a case, your trial has been submitted under the clinical trial directive. It was authorized, and the sponsor is transitioning it to CTIS. And would you want to? Yes, I think in such a case you still need to make the cross-reference in CTIS, because otherwise the information doesn't appear there. And as per the Q&A of the Commission, any document that was authorized. So I know that the cross-reference letter doesn't seem to be necessarily a document listed as such, but yes, it was a document that was used at the time of the authorization. So please provide it as well. So for the next question, do you want to take it, Anna? It's on the third.
Yeah. Is there any list of
party.
the kind of vendors which should be registered in OMS to be further used in CTIS? Well, I'm not sure if I understand this question. So if you as a sponsor are you going to use a vendor that then you need to enter in their application form, you will have to search in OMS to see if this has been already registered. So it might have been already registered by the same vendor or even by another sponsor organization, I don't know. And then you will find it and then you will attach it. You will be able to include it. If you cannot retrieve it from OMS, then you will need to enter that information in OMS to be able to retrieve it, or do it via CTIS, which is an option that currently exists, although we are going in the future, as we explained in previous session, for certain areas, we are going to switch off the possibility to register organization in OMS via CTIS, so you will be able to register that in CTIS. So, but we don't have any. EMEA doesn't have this list of vendors, so you need to search if it have been already registered in OMS or not, and if not, then you decide how to proceed.
So the next question is on the clarification on the Q&A for transitional trial. So there is specific Q&A on this one, and it reads, the documents required to be uploaded as part of the part 2 are the latest approved version of the subject information sheet and the informed consent form. But we have stated during the session today that all approved documents should be included. Correct. I think at the very least, subject information sheet and informed consent form should be provided, obviously. But I think we need to think that in some trials, currently under the CTD, some documents are related to part 2 have already been authorized, and these should be provided. I think this is what we need to regard as all the documents that would have been authorized by the member state in the current state of the trial that is ongoing. So these would be the documents that you would need to provide as well as on top of those mentioned there.
Okay, so I will take the next one. Are Part 2 documents deferrable with main characteristic for Category 1 trials? This marked as non-deferrable in the structured data document, but the appendix on disclosure rule mentions main characteristic, including summary CVs, a statement of head of institution, and a statement of economic interest. So to be honest, I cannot give you an answer. Perhaps there is an error in the structured data, so it is possible that there are some mistakes. So it's good that you spot this issue. So I suggest, Rosanna, would you mind please to take note of this particular point, because we will do a revision of this document, and therefore we can cross-check if this is the case and then make the correction as appropriate. So thank you for letting us know this, and we will see if that is the case, and we will correct the structured data document as appropriate.
Sure, thank you.
So the next one is the hospital is registered in OMS, but its name is in English, not in the local language. Do they need to request? Do they need to request an update of the record? I must say on this one, I would probably want Anna, your support on that one, because I understand that sometimes names have been entered in a local language. All the time, it's true that it's in English, or despite the fact that it might be. It might have been registered in France or Spain or whatever. So
Well,
do you have any?
I think this is more a query for our OMS system, so we are more expert in CTIS, not in OMS. So for this particular one, I think if you prefer probably to have your name in English, you can always request an update of the record. I presume there's not a problem, but to be honest, I'm not an expert in OMS, so we will need to check this.
Very good. So we can actually default an answer at the next when we have an OMS walk-in clinic that we are actually planning. So the dates will be advertised at some point soon. So we can probably keep this one into our bag. Yeah. Thank you.
Okay, for the GDPR, needs the GDPR statement to be signed by the sponsor, or can the contracted CRO sign that on behalf? BFAM at present requests a wet ink signature from the sponsor, which is not in line with minimization of available signature in the CTIS. Again, I mean, this question is not specifically related to CTIS, and I think you have consent that that might be national requirements. I know that there is a workshop in relation to the GDPR based on the document that was launched for public consultation on the 14th of July. I'm not sure if you in particular will attend those workshop or someone representing your European organization where you can raise this question because unfortunately this is more related to national requirements and is the Commission who is responsible to deal with this as they are responsible for the interpretation of the legislation and the supervision of its implementation.
So the next question is on the ability for the sponsor to upload a document the size of 50 megabytes instead of 10 megabytes as currently is allowed. So for this, we have some plan work, but I must say, I don't know whether we have whether we have an update on when this could be done in the system. Do we have a? We know that it's
no, again, as the previous one, this is in the radar, but I cannot confirm the specific date because there are many different incidents and they are planned in different dates. So I don't know, to be honest, the specific date, but for sure it's in the radar and we know that about this issue.
So the next question is about an initial submission. Should we submit the current CV of the main investigator for each site or also the sub-investigator? So clearly not the sub-investigator. What is important here is the main investigator at each site. That is what the requirement is.
The next question is, can the cross-reference to the IMPD approved under directive be replaced by the full IMPD at the time of transition? This will allow the addition of a member state after approval without the need of a substantial modification prior addition. Again, I don't think that this is a CTIS specific related question. I think it's more a regulatory question, and therefore is more for member state to answer this question. So I don't think we're in a position to give you a specific answer on this. I'm not sure, Noemi, if you have faced similar question in training sessions with member state where this particular question came up and was discussed, so you can provide some feedback.
No, I can't. I'm afraid I can't. I think, as you said, it's a regulatory question. And I guess the question I put to you is if the IMPD wasn't at the time authorized under the CTD, are you allowed to submit it? Because then in that case, you then force the member state to assess when for a transitional trial, they really don't want to assess at this point in time. Huh? So make it easy on them. That's what I would say at the time of transitioning a trial.
Maybe do you want to reply this one as you already answered the one on consolidated?
I think consolidated, harmonized, I can only suggest that you go back to your member state on this particular one. We're not, I don't think I'm able to answer this particular difference.
Okay, so for the next one, per CTR Q&A, if RMS does not issue conclusion on Part 1 study status will remain under evaluation. In this case, CTIS timelines will be on hold until RMS complete this task. I think for this, Noemi, probably you know very well the answer as well, as you are explaining the timeline, so perhaps you can support here. Because
yeah, I think that's an interesting topic here, because in fact, what happens if the RMS doesn't conclude? It means that we don't know whether the part 1 is acceptable, not acceptable. So in such a case, you're correct. The status will remain under evaluation. But what's interesting and what's important is that CTI as agreed and as recommended by the Commission, in such a case, the member states can have the ability to decide. And they will have the ability to decide, but obviously they will not be under any pressure in terms of timelines, because currently it's under evaluation. The timelines will enable the member state to make a decision under their own time. So that's important to understand that it's a good way. It's a good way for the member state to be able to conclude on the full evaluation of this trial and provide a decision.
Thank you, Noemi. I want to stress that we are getting close to the end of the event. So I would suggest taking 2 more questions and then going to closing remarks.
thank you. I will take the next one. Is there a specific structure that the change to application document should follow when responding to RFIs? No, we are not aware, and in fact, the Commission in the Hydraulics Bulletin has provided templates for certain documents, but there is nothing specifically on this. So
And then to conclude, the last question here on the screen: is it allowed that the cover letter contains a list of all documents submitted? You can certainly include the documentation that you are submitting. I think you should also refer to Annex 1, and Annex 1 is very specific into how the cover letter should, what it should include or stipulate or state. So use the guidance from Annex 1. Huh?
And just to highlight that in any case, when for all the documents that you upload in the system, at least will we create it always at the bottom of the application, so it will be visible in a first sight, all the list of documents that you have included in your application. So they are not only available in the specific placeholder where you upload the document, but there is also a list at the bottom.
Thank you. And if you don't mind, I will take the next one, which is, can we have more of these sessions? Yes, of course. We will continue with these walk-in clinics till the end of the year. They will be monthly sessions. The next one will be on the 22nd of August. You will see all the details on the email website. So let me just stop sharing the Slido, and we can proceed with the closing remarks. So as I was saying, thank you for attending the CTIS walk-in clinic. The post-event survey will be open right now, so please do share your satisfaction with this event. The post-event survey is still in Slido, so it'll be easy to provide the feedback, and we will appreciate your feedback. A recording of this session will be available on the email website following the event. Please sign up for the CT Highlights newsletter for information on when the videos are available. The questions will be used as input to EMA training and support materials. And we would like to remind you that As I said, on the 22nd of August, we will host the next session of the CTIS walk-in clinic. And on the 23rd of June is the next bite-sized talk on management of a clinical trial in CTIS and notifications. We hope you have enjoyed this CTIS walk-in clinic, and we look forward to hearing your feedback in the post-event survey. Thank you.